The procedure that you will witness over the next couple of minutes is suture removal on a child. There are some important considerations that you need to think about before you even start going with the suture removal. With a child, number one, once you receive the order, double check it that the physician surgeon has written the order, and then you need to go in and provide education to the child and to the parent, and then make sure it's developmentally appropriate for the child, and look and see when you last gave a pain medication to the child. If it has been over 4 hours or so, I would recommend that you do give more medication. And you need to assess, will you use an IV form of a narcotic, or would you use regular Tylenol, or would you use something as a narcotic mixed with Tylenol? And again, that would be up to you and your assessment. Then you need to make sure, after you've provided education, and again, you don't want to give it too far in advance for some of these children, because then they'll worry too much about it. It might be a good idea to contact Child Life to also be present, and if they're unavailable, then make sure that you have assistance, because for children, oftentimes it's the thought of this happening that scares them more than actually what is occurring. So have some form of distraction. Gather, after you've done all that, then make sure you wash your hands, gather your supplies. What you need for supplies is a packet, and each facility that you will attend is different. They sometimes call them a suture removal kit. Some of them you actually have to gather the scissors and the tissue forceps on your own. The best type of scissors, there are two different types. One actually has a little hook in it that you'll see when I go to remove the sutures, and some are what they call an iris scissors, where they have a small curve in them where you can hook up underneath the suture and pull that out. You need a surgical sponge, like a 4x4 or 2x2, depending on the size of the dressing, tape, and then unsterile gloves. Or just clean gloves. You don't need. It is a clean procedure. It is not a sterile procedure. Now, to perform the suture removal on the child, we have everything in place. We provided education. The pain medication has been given and has been allowed to work for at least 20-30 minutes. You have another person with you to help distract and also to help restrain the child. I've opened my supplies. This is what the suture removal scissors looks like. You'll notice this is that little curve that I talked about earlier, and this is a tissue forceps. Sometimes if you find one that is a little finer, that is also a little easier to help you pick up the suture. The dressing has been removed, and what you need to do is actually try to figure out, okay, where is the loop? And I'm sorry if my hand gets in the way, and I'll try to move it again. And if you notice, I'm looking, my hook has to come up under, and notice how I catch and cut. And then the goal is then to remove the suture. Okay, I clipped it, and now I grab my syringe, and then you pull, and you just keep pulling, and normally it is a much longer what is in there, and then you need to hold pressure. They do not bleed very much. They will ooze a little bit, and I would say you need to hold pressure for probably about 30 seconds to a minute. And let's say that time has elapsed. You double check if it and it should start to pull itself together, and then you can just leave that dressing on and secure it. And during the whole time, you're talking to the child, saying what a good job they've been doing, how wonderful they are. We're going to get stickers and be ready to provide positive encouragement.